Hello everybody, we have another wonderful guest today, Jenna Wade. Jenna is one of the chief residents, so it means that Jenna actually runs the department. I'm just sort of a cover figure, but the chief residents are the ones, as everybody knows very well, running the department. There are 3 of them, and we're actually going to talk with all of them, but today is Jenna's day. And Jenna, first tell us about yourself, where you come from, why you decide to be a doctor, and why you're in Atlanta.
So I actually grew up in the military, so I moved around a fair bit, and I had been in like the Maryland, DC area for quite some time. It's where I did undergrad as well as medical school. So I'm not from the South, so this was definitely a transition coming down here. Atlanta's great, but it was a transition.
I'm not from the South
yeah.
either, just in case you want.
Really?
Yeah. Anyways.
And so I guess like why I became a doctor and how I got into that. So I do come from a family where a lot of people are in medicine. My dad's a physician, my mom's a nurse practitioner, her father was a dentist, so it's kind of in the blood, so to speak. So I grew up like hearing all these stories about patients, and it always kind of like sparked my interest. And I also really liked math and science, so it kind of seemed like the natural fit. And then my brother ended up going to medical school, so I guess I was a bit uncreative in deciding to go to medical school too, but it's just something I truly have always found fascinating.
Why Atlanta?
Why Atlanta? So that actually came about when I was doing a 4th year elective, and one of my friends who I met on that elective had just come from a rotation at Emory, and she actually was like singing its praises. And so I was in the middle of applying for a bunch of residency programs, and I honestly just like total whim decided to apply to Emory. And I was like, let's just see what it's like. I trust Jen, we get along, we're kind of similar. And so I came here, and I had already been on a lot of interviews. This was actually my second to last one, so I had a good feel for like when I liked a place or when I didn't, and it was kind of that gut feeling that I just really liked the place. And it started out with really the people. I just remember looking at the residents and thinking that not only were they a crazy smart bunch, but I felt like I could be friends with them both inside and outside of work, which was important to me since like I don't have family here and I don't know anyone. So
this is very important because we really care about this environment, this department to be a good environment where people work well, efficiently, but also have a good life in general, an harmonious balance of the many demands that we deal with. Tell us what it is to be a chief resident.
Well, it is a lot of work. I am not going to lie. But I already have enjoyed a lot of things, and I think it's a great experience where you learn about leadership as well as just like how to deal with all sorts of issues and all sorts of people, and you certainly learn how the department works. And it's really helped me like hone in my organizational skills of just keeping on top of everything.
That's great. And chief residence is a very exciting moment in your life, but it only lasts 1 year, right? Mm-hmm. So what's next?
So I'm currently at the beginning of my 4th year, so I'll finish, and the way we do chief residency here is you start halfway through your 3rd year and you'll end halfway through your 4th year. So I'll have the remaining 6 months of residency to finish, and then I'll actually stay here for fellowship as transfusion medicine, which I'm super excited about.
See, people come here and they don't want to leave anymore. That's very good. So since we are on the theme, what are the main reasons why all those 4th year medical students, 3rd year medical students that start thinking about residency in pathology should definitely consider Emory as a program to apply?
Well, I think what makes Emory particularly strong is that it's really good at both AP and CP, as well as we have EP as well. So we have so many different areas within pathology that are all so strong, which generally when you have good programs, it's kind of like they're good at AP or they're good at CP, but not all 3. And another thing is that we have, like 10, 13 fellowships. We have a ton of fellowships, and basically all like the main subspecialties you could think of that you'd want to do. And it's nice not to have to move for just 1 year. And you also know the system, and there's such volume and variety. Plus we have a ton of different sites as well, so you get all sorts of different kind of cases and patients as well as systems, all of which I personally think strengthens you as a physician.
Yeah, lots of good things. The only negative thing I have to say is that for the residents that will come next year, they will not get to work with you as chief residents, but we'll find amazing new chief residents anyway. Yeah, thank you so much.
Oh, thank you. It was a pleasure.
To do this with you. Bye bye.